When Gene Autry was given some award, he would oftentimes come to the podium and he would say, "I don't really deserve this recognition. But then again, I have a hernia and I don't deserve that either." Well, it's a privilege to be able to join you for this annual luncheon and to welcome our distinguished guest, Congressman Henry Waxman. I want to commend those of you who are here today who support the California Social Welfare Archives that are housed here at USC. And I'm told by our Dean Flynn, that only 2 states maintain social welfare archives. One, of course, is California here at USC, and the other is Minnesota at the University of Minnesota. So this is something very, very special. Those of you who support the archives are stewards of a vital legacy. The history of social welfare in California tells an important story about this state and about its people. Like artifacts from the strata of a civilization, the letters and papers and journals and reports and other materials gathered into the archive illustrate the broader history of this state. The archive also preserves the legacy of notable individuals and organizations and programs who were driven by a desire to make a difference in this world and to improve lives. These people were indeed driven by commendable ideals and values that I know are shared by all of you in this room today. We hear a lot of talk about values these days, especially in the precincts of the Potomac, where our distinguished guest spends much of his time. Values. It's a buzzword, I suppose, that is subject to widely divergent definitions and interpretations. Vague and open to interpretation, the word is often exploited to stir up discord and division. But when you look at Henry Waxman's record, you see something special. What you see over the course of his 32-year incumbency in Congress is a record of genuine and laudable values. They are values that everyone in this room today holds dear. They are values such as the protection of our society's most vulnerable, that is, the elderly, the sick, and children. An unflinching quest for the truth beneath layers of untruths, half-truths, and spin. Concern for the vitality of our planet, its precious resources and fragile ecosystems. And of key importance to me as the president of a research university, Henry's passionate support of research and education and support of scientific inquiry that is at once ethically responsible and unfettered by political agendas. Yes, it's true, Congressman Waxman is a Bruin, but we forgive him that. Indeed, we have made him a Trojan by adoption. Representative Waxman has attended several USC alumni receptions on Capitol Hill, and in fact, he was honorary co-host of our DC reception this year. This past June, he gave the keynote speech in the annual Warsaw lecture series of the USC Kasdan Institute for the Study of the Jewish Role in American Life. A couple of his staffers are Trojans. In truth, he is a very open-minded gentleman, and by my reckoning, a loyal Trojan. But more than that, Henry Waxman has helped ensure that USC's faculty and physicians are getting the federal support they need to conduct vital research into everything from climate change and stem cells to clean air and AIDS. Amidst a national mood that some have described as anti-intellectual, he has helped ensure that education remains a supreme value, that our leaders continue to believe what Thomas Jefferson asserted, that education contributes to the improvement of our country and indeed to its long-term preservation. 3+ decades of service in Congress have not dimmed Henry Waxman's passion, idealism, and energy. He's a man with the courage of his convictions, and 3+ decades in Congress have not dimmed his sense of humor either, and that perhaps is the noblest achievement of them all. I'm delighted that over the years he has strengthened his bonds to USC, and I'm grateful that he works tirelessly for the two world-class research universities in the city of his birth, Los Angeles. He well deserves the George D. Nickel Award for outstanding volunteer services that he is receiving today. On behalf of the entire USC community, I offer Henry our heartfelt congratulations. So ladies and gentlemen, please welcome the esteemed representative of California's 30th District, the Honorable Henry Waxman.
Thank you very much, Dr. Sample. I'm honored by that very generous introduction. I didn't deserve that one either, but I'm happy to hear it. And I'm greatly honored at the fact that you took the time out of your busy schedule to be here to present me to this audience. I think it's an honor to receive the George D. Nickel Award for Outstanding Volunteer Service, but particularly because of the group of people and the organization that has been represented here today as a steadfast commitment to the principles of social welfare and social justice. And I particularly want to acknowledge my longtime friend, Ralph Furtick. For those of us who have known him, and I've known him for decades, I know the fire he brings and the passion he has for social justice. And I think the School of Social Welfare and Law and other activities here at USC is well served by the fact that he is able to share that with all of you. Thank you, Ralph. To be here with all of you is familiar territory for me. From the time I first became involved in public office and in politics, I entered with an idea of esteem for being in public service. I also thought that it was important to bring a commitment to certain values of human rights, civil rights, sense of responsibility to do what I could to help all people to be able to live a life of security and realize their full potential. And these are the values that continue to govern my actions today. And I know those are the values that have brought you into the career of social work, education, and public service. But these are not the values that I see in Washington today. Under this administration and this Congress, the need, as they see it, to protect private wealth is given a priority over the need to provide for the least among us. They think it's more important to reduce taxes on the wealthy over having adequate public resources to fund the programs and services that should be the business of a humane and caring society. Those in power today are more interested in advancing business interests than in protecting the environment, as if they were inconsistent. And they're much more attuned to ideology, like deregulation, than making sure that we have government agencies like the Food and Drug Administration and the Environmental Protection Agency and others that have a serious mission to provide for all of us, whether it's to make sure that we have safe and effective drugs, food that won't poison us, and an environment that will be a gift that we can hand on to the next generation and not use up today for our own selfish purposes. But perhaps most basic of all, those in power are more interested in reducing the public role in assuring income security and adequate health care than in being sure that people have the help they need. Their cause is to tell Americans to exercise your right to individual choice to protect your own future. Well, that sounds wonderful. But their vision means that the combined power of the people is not harnessed to meet these basic needs. In fact, those priorities are, in my view, wrong. If you're rich and you have a lot of private resources, you might think it's okay to have your own investment to provide for your retirement income, but you shouldn't then disregard the needs of others If you're able to, through your health and wealth, provide money in your health savings account instead of a comprehensive health insurance plan, you might get some tax breaks, but you're not adding to the benefit of others. And when you get sick, you may not have the healthcare infrastructure you need, even if you can afford to pay for it, to make sure that you get the best care. And some people think it's just fine. Go out and pay for private schools. Go out and hire private police. There are even judges who are for hire private judges. And then what we see is that the public education system, the public police force, the public system for all of us is something they're willing to sacrifice because they feel they have their own taken care of. Well, this is not the way to enhance the social welfare. This is not the way to provide the basic values articulated by Franklin Roosevelt so long ago. He said that we needed a second Bill of Rights, one that recognized that true individual freedom cannot exist without economic security and independence. The values he enumerated were the right to a job and a decent wage, the right to adequate medical care, and the opportunity to achieve and enjoy good health, the right to get a good education, and protection from the economic fears of old age. Those should be enduring values for our society. They should not be something that becomes the right only of those able and wealthy and advantaged to take care of just themselves. Of course, you can listen to all politicians say that they believe in values of taking care of everyone, but what you really need to do is look at the current majority in Washington and how they have failed to live up to these values. Have we raised the minimum wage? No. If we had raised it, oh. I always forget that I'm too available. If we had raised the minimum wage, at least since 1977, people would be able to have a decent minimum wage, be able to support themselves and their family. But the Republican majority won't even let us bring it up to a vote. So it's stuck at $5.15 an hour. It's the lowest level in real terms that it's been since 1968. But the average salary of a CEO is 821 times today what the minimum wage worker receives. Do we, as a compassionate nation, take care of kids in, let's say, foster care? No, not when we have limited eligibility with an income standard for the birth family that hasn't increased since 1996, 10 years ago. So we've been able to stop at least the worst proposals to block grant the program, but we're starving it. And that out-of-date income standard means that federal funds support less than 50% of the kids in foster care. And then there's education. And one example is that since 2001, the cost of attending a 4-year public college has increased by $3,095. That's about 1/3. Yet the share of these costs paid by Pell Grants has dropped from 42% to 30%. Well, it's not a pleasant picture when you look at some of these examples, and they can be repeated over and over and over again by how we've made short-sighted cuts. But the picture in healthcare, an issue that's always been my prime legislative concern, is really bleak. Today, nearly 47 million Americans are without health insurance. Last year, for the first time since 1998, when we adopted the Child Health Insurance Plan, the S-CHIP program, and it went into effect, the percent of children who are uninsured increased, growing to over 11%. Further, the share of Americans with job-based health coverage fell over the last 5 years, erasing the gains that occurred during the Clinton years. and it continues to decline even as individual workers are asked to pay higher premiums and a larger share of the bill. Well, let's step back and think about what's going on here. Traditionally in this country, where you worked was where you got your health insurance. The group insurance market, which covered the large group covered by employers, was a way to provide coverage to individuals while protecting them from the shortcomings of the individual insurance market. If you can get insurance coverage at all through the individual insurance market, you would find yourself with extra high premiums, but if you had a medical problem, they wouldn't want to cover it. It's a pre-existing condition. And if you get sick, they're very anxious to drop your individual health coverage completely. So when you need the coverage the most, you're denied it. But the employer-based group coverage was supposed to protect us against that. For those who weren't well served by this employer-based health insurance model, the aged, the disabled, the low income, we developed the twin protections of Medicare and Medicaid, public programs designed to fill in the gaps of the private system. So it wasn't perfect, but most people had their insurance through their jobs, and then when they retired, they had Medicare. If they had other reasons for losing health insurance, such as poverty, they had Medicaid. There are some people who were still left out, but it covered a lot of people. It covered most people. But what we're now seeing is a retreat in the direction that undermines the best parts of what we have now. Let's look first at Medicare. Its great strength, it is built on a social insurance model. We all pay to support it because we'll all be going to be covered by it. And we'll all have coverage because our benefits will be clear and guaranteed. But that's not the vision of this administration or the Congress for Medicare. They want first and foremost to privatize it and to turn it into a program that's called, in the healthcare jargon, premium support. That means simply giving people a voucher and letting them get coverage for themselves. The theory is that their coverage will be better and cheaper because these individuals are going to go out there, use their wits with bargaining power to get a better deal, and that's bargaining power on their own, and they think they're going to get a better deal than the combined purchasing power of all Medicare beneficiaries acting together. Well, despite all the evidence about how poorly our market operates in so many different circumstances, particularly in health care, this is the philosophy that they're using to try to change our system. First, it limits the government's obligation, and that's what a lot of these people have in mind. If you can limit the government's obligation, you can start cutting public spending, and that becomes pretty attractive for people who don't believe the government ought to be involved in helping people. Even this administration doesn't come right out and say what they're doing, but when they design a prescription drug plan, we can see what really they're relying on is a private insurer market. They even went so far in designing the prescription drug plan that would ban the government from using the collective buying clout of millions of seniors to get discounts for drugs. It's a gift to the pharmaceutical companies, and the pharmaceuticals give them gifts in return. But it's mindless when you think about the power of the buying clout of millions as opposed to the buying clout of an individual. And that's the way, however, they look at the matter. And then they want to have us go to the private insurers, but to make private insurers more attractive, they want to overpay the private insurers more than they need to provide that coverage. And then they can try to skim out the sick and those that are going to be the higher risk out of the insurance plan. And in doing so, they can make more money. But we can look at what's gone on in healthcare and see that the aim is insurers and HMOs doing what they're the best at, eliminating the costly risk. But what happens to those who get sick? What about those who are not able to fend for themselves in this image that they have of the rugged American individual? Well, they're going to be left in a very difficult position. When the program deliberately overpays these private insurance plans, they're establishing hefty profits for the insurers, but they're undermining the strength of traditional Medicare. That's simply part of the long-term plan that they have to make people so dissatisfied with what's left of the public program, which is what's left to cover the people who can't afford anything else, that they feel then they can move to a voucher system and let them fend for themselves, and Medicare will not be there as a public insurance program. Soon the result of all these policies will leave the sicker and the older in the traditional Medicare plan, drive up its costs, and then drive Medicare out of business. Well, let's look at the Medicaid program. For all of its problems, and there are many, it's been literally a lifesaver for a program for millions of Americans. It now covers 55 million people, more than is covered under Medicare. It guarantees coverage for all poor children. It covers nearly 40% of all the births in this country. It provides critical coverage for persons with disabilities, covering services that simply aren't available through many private health insurance plans. It pays for more than 40% of the long-term care for those in nursing homes particularly. It was the first program to provide coverage for people with AIDS, and it's truly been the safety net taking on the hard and expensive cases that private insurance leaves behind. They're not anxious to cover these people. It's going to cost them too much to cover these people. But the Medicaid program has constantly been plagued with inadequate funding, and that's what happens when you have an income-tested program. If it's a program for poor people, the legislators feel they can cut those programs because, after all, poor people, they're not as vocal. They don't vote as much. They're not as visible. They're not as outspoken. As the needs and costs of care of its population have grown, states are unable or unwilling to provide their share of the burden, at the same time that the federal response is to try to drive more of the burden onto the states and try to limit the federal dollars that have to go into the system. Well, we now have an administration that thinks that health savings account would be an ideal way to help poor people. They think you can take away the guaranteed coverage of Medicaid and then let these individuals negotiate the insurance market for themselves in the most confusing market out there. It's so wrong-headed a concept, it really leaves you breathless. And the best example to me of the absurdity of their theories is when they had the prescription drug coverage for dual eligibles, people who are on Medicare and on Medicaid. And their philosophy was that they'd shop around for the best insurance coverage for prescription drugs. Well, you're talking about people who have mental disabilities, physical disabilities, many in the nursing home. They're not about to figure out what's the best plan. Even the most sophisticated seniors were having a difficult time trying to figure out what was their best plan. So when they couldn't figure it out, they were assigned to a plan. Is that a market-driven system? They weren't able to make the selection, and then they were assigned to a plan to take care of them. In the face of the cost pressures on the employer-based system, the answer of this administration is to encourage these high-deductible plans, HSAs, shifting the costs onto individuals. So in the public sector and in the private sector, let's just make people pay more for their health care. So the answer they see is to put people back into those individual markets where They can loosen the insurance regulation, let people buy skimpy insurance system because that's all they can afford. They break down the risk pool, which should be spreading the risk across a broad population, and they will end up costing sick people or women of childbearing age more, and it will, when the market leaves them with choices which just cannot be rationalized. Well, I think you can see an overwhelming overall theme here. You can recognize that whether it's breaking down the risk pool, which is what insurance is supposed to be about, or breaking down the social insurance base, which has been the strength of Medicare and Social Security, the theme is the same. The social welfare doesn't come into it. The healthier and wealthier can take care of themselves, and heaven help everyone else. When I heard I was going to receive the George D. Nickel Award, I looked into some of the things he stood for, and I found he was instrumental in passage of mental health legislation in the 1950s. I couldn't help but think how disappointed he would be to know that we're still fighting for mental health parity today. We can't get the Congress to recognize that mental health involves treatment and care the same as physical health. There should be no distinction between the two. I'm the ranking member of the Government Reform Committee. I'm still on the Health and Environment Subcommittee, but the Government Reform Committee is the committee that does the investigations. It's supposed to do the oversight over this administration. Well, the Republicans aren't anxious to do much of that because they might find things that for which the Bush administration might be criticized. So they're pretty quiet. Certainly a stark contrast to where they were when Clinton was president. There they were anxious to investigate any small allegation. They would hold hearings, they would issue subpoenas, they would make wild charges that turned out to be invariably untrue. But now that they have one of their own, President Bush is president, there's not a scandal too big for them to ignore. It just really is quite remarkable. So what I've done, using the minority staff, the Democratic staff, is to try to do some of the reports on issues that I think are important. And we did a report that we released that found an unconscionable number of children with mental illness end up in detention facilities because we don't have anywhere to treat them. When the estimates are that some 2,000 young people are in detention because community mental health services are not available for them, it's hard not to despair at our mixed up priorities. Imagine putting kids with mental health problems as if they were prisoners in detention. Well, why is it that we're always shocked and dismayed when we have terrible incidents like the tragedy in Lancaster County last week? Don't we understand that society as a whole is suffering because we won't invest the resources to help people and treat people with mental illness before these tragedies occur? And nothing is more heartbreaking than reading the stories of families or meeting with those family members dealing with a son or a daughter or a parent who's obviously mentally ill, and yet they cannot get services for them. Why are we so continuously surprised when we find the results are so tragic? Well, somewhere along the way, too many have forgotten that the social welfare is critical to all of us, not just to those who are benefited, but to all of us. Every child we don't educate, every person who we can't reach so that they can live up to their full potential because they're sick or in poor health, every troubled person who goes without the care and interventions they need, we are all poorer because of those failures. You understand that, you who are involved in social welfare. Your commitment to service and the social welfare demonstrate that. And I have to believe, I think we all have to believe, that the principles of social welfare and social justice are so ingrained in the American ideal that they're going to come back stronger than ever before as a basis for our public policy. But we're going to have to work to make that change happen, and I don't think we can accept any less. It's been a difficult time that I've seen in Congress and in policy making in these last 12 years or so. I came at a time when public service was held in high esteem, when you got down to it, it didn't make that much difference often, whether you were a Democrat or Republican. You looked at the facts, you looked at the evidence, you tried to figure out what would make sense. What policy should we pursue? I always welcome input from those who disagreed with me because that always made the legislative product better. Well, we've had in the last 12 years the idea that Republicans should just operate on their own and ignore everybody else, certainly not talk to the Democrats. They don't want to do oversight because they believe they're Republicans first rather than the leaders of an independent branch of government as their highest priority that would provide the checks and balances that our governmental system envisioned. And they've done a disservice. And the ones they've done a disservice to the most is President Bush and the Republicans. Because if you bring in other ideas and you listen to different arguments, you're less likely to make the serious mistakes that we've seen made over and over and over again by this administration and the Republicans in charge. Well, I thank you for this wonderful award, and even more importantly, this opportunity to talk to you, and I thank you for the work that you're all doing, your commitment and all of your extraordinary contributions to make life better for everyone is something to be valued. And when people talk about values, that's the highest value of all. I'm proud to be honored by this group. Thank you so much.
If the Democrats regain Congress, the House of Representatives, what do you plan on doing first?
What am I plan on doing first? Celebrating. But then the next thing I would do, and urge my fellow Democrats to do, is to learn the lessons of all the things the Republicans did that we were so offended by. And that means to me, immediately reach out to them, try to restore civility, try to restore bipartisanship as best we can, but give them an opportunity to participate in the legislative process. Committees used to be the areas where people had expertise. Now committees are ignored. Decisions are made by the leadership. They bring the bill to the House floor, they're rewriting it as they move along. They're not even thinking what the consequences are of some of these proposals. And they don't have input even from their own members. So I think we've got a lot of good lessons of how not to do things, and we should learn from it and try to do things the way that I think would be best for the system and for the American people.
Yeah, I have a question. Why does it appear that the Democrats can't find their voice and figure out how to make a strong statement of what they stand for that will move people?
Well, that's a question I'm asked often. And the reason I'm asked often is because people feel that the Democrats are not speaking out with one voice and giving the American people the kind of alternatives that we believe in. Part of the problem is institutional. We don't have the fully pulpit of the president. We don't have either house of the Congress, so we can't hold the hearings to spotlight issues. We don't have a single leader, but a number of different leaders who have different priorities and don't always speak for everyone. So as hard as we do, we don't get a single message out there. People often, however, ask me, why don't the Democrats have a solution to Iraq? Well, that's what the Republicans say. Well, what would you do? They make a mess, and then they say, what would you do? Rather than accept responsibility for what they've done and the mess that we're in. We have different views, which is always characteristic of the Democratic Party. Bill Rogers said, I'm a long-dated organized party, I'm a Democrat. But it's true, we have different views, and sometimes I think we're meritorious and deserve it. Sometimes I think what happens is that you take advantage of the fact that when you're in the opposition, you're the alternative. And if you've had enough, it's time to give the alternative a chance. And then I think you'll see a much more coherent Democratic Party initiatives and points of view as we look to the 2008 presidential election, where we will eventually end up with one spokesperson who will articulate what he or she would do as President of the United States and leading this country on a number of very important policies.
Looking at the LA County Department, of Health Services from Washington, D.C., it's projected that it will be deeply in debt, perhaps bankrupt in a year and a half or so. We have the Martin Luther King Hospital debacle. So from a federal perspective, as you look at this troubled health system that's the safety net for so many millions of people here in the county, what would you do?
This is the first time we've had a really dim view of the future about the LA County system. We've had it in the past, and what I was able to do with others is to provide greater federal resources to try to help the system make a transition from more inpatient services to more outpatient services, and to try to bring together a greater coherence with a lot of the community clinics and others who could provide the outpatient care. But this is a very difficult job to do, to change the system in any dramatic way in a short period of time. But what we've seen now in Washington is the rug being pulled out from under LA and all the safety nets, especially public providers. We've relied on federal dollars to give a little bit of an advantage to those institutions that have a greater number of uninsured patients, or underinsured patients, or publicly insured patients where the reimbursement is not adequate. So we've added different add-ons to their reimbursement to try to help them get through their problems. The Bush administration said, well, they shouldn't have to get that extra reimbursement. We'll just cut back on it.
The state of California negotiating a waiver to allow the Medi-Cal system to do what it had been doing under Democratic and Republican governors, to contract with providers under Medi-Cal. The Bush administration, which argued states ought to have more ability to make their decisions, and we'll use the waiver system to give them a chance to experiment. The traditional waiver that should have been allowed was used as a way to blackmail the state into agreeing to a lot of changes that hurt the state and the county before they could get the waiver to continue. So the federal system, the federal government has used everything it could to undermine our system. And I've argued to people in Washington, okay, you don't care about the poor, but you presumably care about terrorism. How can you allow an infrastructure that serves all of us to deteriorate to the extent that we're going to see in the next few years, and we're already seeing today? And the response we get is a nonverbal shrug. It's not their problem. Like so many things, it's not their problem. They're busy passing tax breaks for the rich, and we can't afford it, as they see it, to support these programs that are so important to those who aren't rich, and to those even who are rich who think that they're invulnerable, but realize, unfortunately, too often that the lesson we all teach is we're all in this together, and we all must make sure that we're taking care of each other.
Thank you so much for being here. And we've had a different kind of terror on the streets of Los Angeles and all our large cities. And with the terror of tens of thousands of homeless, and we've got a government that has slashed programs for housing the poor. In your position as chairman of the Government Reform Committee, what would you do? What do you think the federal government response should be to the problems of the homeless?
I think we've got to look at it in a number of different ways. I can't say that I'm an expert, but when you cut back on mental health services, what do we expect? People who are so vulnerable, don't know where they're going, disorganized in their lives, just make the best they can for themselves, often on the streets because they can't find any other alternative. It's a housing problem, it's a medical problem, it's a humanitarian problem. I have to say to you that one of the things I'm looking forward to if I become chairman of the Government Reform Committee is that committee has jurisdiction over everything and anything. And I'll be able to spotlight some of these problems and get attention to these issues so that we can drive the American public to demand, in the last 2 years of the Bush administration, changes in their policies and get us ready to even make more aggressive changes when, after 2008, whoever gets elected president will be able to realize that these are issues that are not going away. They've been swept under the rug, but these problems are not going away. They're there, they're getting worse, and we're all worse off because of them. I'm going to have one last question over there, and I see dessert, but I'm going to...
Waiting to say, I'm going to run back to the office and look at people waiting.
This is a general question. Is there anything that the Reform Committee can do to counteract this culture of non-accountability that seems to have been fostered by the present administration?
Transparency and accountability are the essence of a democratic system. How can people make choices if they're kept in the dark about what the policies are, what their leaders are doing? And that, to me, undermines and subverts the whole idea of democracy. And to me, it's astonishing at a time when we're telling the rest of the world, you've got to be more democratic, with a small d. We are acting less democratic here in the United States. I've never seen an administration that's operated with more secrecy than this one. And unfortunately, it's at a time when the Congress is enabling them to do it by giving them less scrutiny and holding them to less accountability. Well, in a democracy, we must demand transparency and accountability. I think that's what we'll be able to do if we can get the two parties involved in the government. It didn't have to be that way, but the Republicans have decided they're not going to live up to their constitutional responsibilities. So, forgive me for being partisan. I think we've got to get the Democrats in power. But I was interested when a man that I'd met a number of occasions in Israel came to see me, and he was chairman of the Oversight Committee of the Knesset, which is their parliament. And I said to him, how can you be chairman of that committee? I know you're not part of the coalition, the ruling coalition that's in power. You're in the opposition. And he told me something interesting. He said, in Israel, the Oversight Committee is run by the opposition for fear that the party in power, which is not only the legislative but the executive branch, will not want to bring out the problems about the work they're doing. So I think that's an idea that we ought to look at. I certainly appreciate it when we're in the minority. I don't think I want to give it up when we're in the majority. But what we need are people who will take their responsibilities seriously in the government and in the Congress. The exercise of oversight and investigations is maybe even more important than legislating, because we've got to make sure that the legislation is working and we're mindful of the problems that we need to look at so that we know that they're there so we can address them for the good of all the American people. Thank you all very much. I appreciate it.